BrainCore Therapy at its heart is a type of neurofeedback, which is a type of biofeedback. Biofeedback refers to something where your brain is somehow given the opportunity to observe a body function, like skin temperature or heart rate or respiration, and then the brain, given certain feedback, can control that body function. Biofeedback, when you're talking about the brain waves as the thing being controlled, is called neurofeedback. And that's very powerful, and it's the only way I know of that the brain has to actually observe itself and how it's functioning, and therefore change itself so that it functions better. BrainCore Therapy, as I said, at its heart is neurofeedback, but we've also had some other things that we've found help the neurofeedback work better. Audiovisual entrainment is one, where you're stimulating the optic nerve with a certain frequency of light, as well as the auditory nerve, so that the brain is kind of bathed in these frequencies, so that I like to say it relaxes more in a way that it needs to. We often do that before the neurofeedback session so that the brain is more relaxed in the way that it needs to be, so that it gets a better neurofeedback session. Several other things we use, another type of biofeedback called the M-wave, from HeartMath, which is a really good system, and you can find out about these things elsewhere on the website. We often do craniosacral therapy. It's really important that there's no undue pressure on the brain when the brain's trying to heal, so I very often do that. And then, so it's kind of a whole package, the BrainCore Therapy.